Our first guest today is Angie Fisher, Director of Clinical Improvement at Novant Health Brunswick Medical Center. Well, hey Angie, welcome back to the show.
Thank you. It's good to be here.
Now, I know you've been here before, so you're an old hand at this, but let's remind our viewers about who Angie Fisher is and what you do and a little bit about your background.
Sure. Well, I've been at Novant Health Brunswick Medical Center for it's almost 17 years now.
That's
Started out in the emergency department and then did the operating room before I moved to administration. And I've been there probably 10 years in this particular role. And as far as my background, I have an associate degree in nursing, then I got my bachelor's degree, and I have a master's in healthcare administration.
Wow. That's a lot of education, Angie.
It takes a lot of training, I guess.
Yeah, it sure does. You mentioned that you'd been at the medical center, 17 years?
17
Boy, so you've
years.
seen a lot of changes.
Lots and lots of changes.
Yeah.
New hospital, but lots and lots of changes.
And you briefly said that you'd been in this position for a number of years. And what exactly is your position?
My title is Director of Clinical Improvement, and that honestly encompasses a lot of areas. It includes hospitals' efforts to improve quality. It includes our relationship with government or reporting agencies, regulatory agencies like Joint Commission. So honestly, anything in that kind of umbrella fits under my department or my employees.
That's interesting. It covers a lot of territory,
It does.
though. You have to really be on your toes to make sure that everything's
We
done
do
the
our
right
best.
way.
Absolutely.
Well, today we wanted to talk about the flu, of all things, the flu.
Yes.
Have you seen a lot of flu cases this year so far?
We have seen a tremendous increase
Really?
this fall. It's very marked increase probably December 21st, 22nd. We had probably a 50% increase in the number of positive cases, and that's just continuing now into the new year.
Well, I hear a lot of people say, oh, I think I have the flu, or they really have a cold, but they say, I have the flu. What are some of the symptoms of the real flu?
The real flu, you would probably expect a fever, 100 or higher, body aches, chills, probably runny nose, stuffy nose. In kids, you may see nausea, vomiting, diarrhea, that kind of thing. It's very similar to the cold, but honestly, it's the degree of it. How sick are you? It's kind of like the cold is this, the flu's this. So it can be much
the
worse.
symptoms are similar, but
Definitely
much more pronounced with the flu.
Yes.
Well, if somebody thinks they have the flu, I hope they stay away from us, but should they go to like an urgent care or the emergency room?
Well, honestly, between the two, your most urgent cares are very well qualified to take care of a patient with the flu. If you had other underlying illnesses, emphysema, COPD, you may have special circumstances that would need an emergency department, but by and large, an urgent care, your physician's office, they're going to be able to take great care of you.
That's good information. I think sometimes we run to the emergency room too quickly.
Absolutely.
Maybe, and urgent cares do a great job, but of course everybody really needs that primary care physician.
Oh, absolutely. Absolutely.
Well, how about other resources? Are there other resources available to folks who have questions?
Absolutely. One of the great things that we offer now at Novant Health is the Careline. Care Now is what it's called. And that's a phone number. It's 910-721-2273. And you can call there, actually speak to a nurse, and they will actually help you figure out, where do I need to go? Do I need to go to the emergency department? Do I need to go to an urgent care? They'll even call ahead and let them know you're coming. They can help, if you're going to a Novant physician, they can help make an appointment. So it's an awesome service. Again, it's Care Now, and that'd be the first thing I'd think of.
And it's free.
Yes, It's totally free.
Ooh, that's awesome.
It is.
That's
And they can help with this, help you sort through a lot of questions and navigate what you need.
wow, that's great. I really like that.
Got that on my refrigerator. Absolutely.
Oh, good, good. Lately, I've been seeing folks out in public, like in stores and what have you, and they'll have a mask on. Is that a good way to stay healthy? And what other tricks can you provide us to?
Well, honestly, my recommendation would be if you're sick, stay home. For your sake, for other people that you're around. But, if you absolutely have to go out, maybe a mask is okay. But rest, lots of fluids. I can't stress enough the importance of hand hygiene. Washing your hands, covering your cough, all those symptoms, those signs that we see are perfect. That's what you need to think about.
Okay, well, I'm already healthy. I don't have it. So how can I stay that way? Just wash my hands?
Wash your hands.
Wash your hands, wash your hands.
Wash your hands, wash your hands, wash your hands. Absolutely.
That's like the best thing. Huh?
It is. It absolutely is.
Well, good, because there's no magic pill for not.
No.
Well, I think I heard the other day that the hospital sometimes has flu restrictions. Can you explain a little bit about that to me?
Sure. You're right. Right now, we implemented visitor restrictions starting January 2nd.
January 2nd.
January 2nd at 8 a.m. And we are restricting visitors under 18 years old. And hospitals do that periodically. So yes, we do have that in place right now.
Okay. And how long would the restrictions be in place?
Honestly, it's going to depend on this flu season. We know that based on what we've seen, increase in the number of cases, this is looking like it's going to be a severe flu season. So we will honestly look at that every week, and we will look at, okay, are we still getting lots of cases, or has it dropped off? We're also being mindful of the fact that we know that the strain of flu that we're seeing this year was not covered by the vaccine. And that happens sometimes. It's your best guess. What do we put in the recipe? But
it's like making soup.
It is. It is, and you're kind of guessing. But we know that people who've had the flu had the vaccine. So
wow, that's not encouraging.
I understand.
Are there any exceptions to the restrictions, Angie?
There are. Obviously, if the person is under 18, but they're seeking care, if you need to be cared for, we're going to take care of you. If you're the under 18, but you're the parent of a child that needs care, that's fine. We also would have some circumstances if we're facing an end-of-life situation and you need to be able to say your goodbyes. We're going to work with that and do what we need to do.
Oh, well, that's good to know. There are always exceptions to every rule, but I know you want to make sure that the patients are safe as well as the visitors. So the restrictions are there for a reason.
Right. They're there for both sides, absolutely.
Right. Thanks for being here today, Angie. I look forward to having you back, and we'll talk about something maybe better than the flu.
Sounds good. Thank you.
Great.